Welcome back. Today is World Health Day, and the theme is health for all. But it's no secret that experiences of South Africa's healthcare system differ vastly depending on whether you have access to private healthcare or not. Let's discuss this further with Professor Renata Schoeman. She's Head of Healthcare Leadership at Stellenbosch Business School. Thank you so much, Professor Schoeman, for your time. So, we're marking World Health Day, but we still have many challenges with access to healthcare. You've said that currently failure in providing a basic standard of care to the more than 84% of our population reliant on public healthcare is intensifying. It's not getting better, it's getting worse. Highlight some of the biggest hurdles for us, if you will.
Good evening. There's a number of problems, although compared to international standards, and especially if we look at the OECD countries, we are spending an average and fair amount of the GDP on healthcare provision in South Africa. However, this money is not used efficiently. It's dwindling away. Infrastructure is deteriorating. There's corruption. We need strong leadership to make sure that people really are behaving ethically and utilize this money to improve the value that we provide for our citizens in terms of increasing the outcomes, the service and the quality of care that we deliver them without increasing costs further. The other problem is, although the overall budget is increasing, there's stark inequalities between provinces. For example, the Free State and Limpopo, where things are really busy deteriorating significantly. So in certain areas of the country, we have made improvements and great strides, but it is not equal access, and it is not improving in vast majorities. Just if you look at the news over the past couple of weeks again, in terms of maternal health care, for example, or mental health care, you will know that it's really not the experience of the vast majority of South Africans.
So apart from access being unequal, infrastructure crumbling, spending in the wrong places, we also have massive staffing issues. Our facilities are chronically understaffed, and yet we have graduated, qualified professionals who can't access those positions because they're not being filled or advertised, or, where is the disconnect coming from?
It's a huge problem because we keep on saying we need more doctors in the country, and we do. We only have 6 doctors per 10,000 people, where other countries have 20 and even 40 per 10,000 of the population. So we're in dire need of doctors and other healthcare professionals. However, we train, but we don't provide employment afterwards. We know how many community service doctors, i.e. the doctors that completed their training but now need to work in the public sector to be able to register as healthcare providers in the country, do not get positions. There is just no position, there's no budgeted for it, so the money is slipping away and not being paid for positions. The same happens with specialist training positions. We don't have enough specialists, yet we freeze positions. We can't advertise them, we can't employ people, once again, because money is going in the wrong places. It's not efficiently managed. And what we then see is brain drain. So 2 things happen. The public sector doctors, because it's understaffed, the pressure on them is intense and we see burnout. But then they leave the public sector to go to the private care sector. But then now the private sector is also unstable because no one knows what's going to happen with private healthcare and if there's a secure future for their doctors in private sector when the NHI is rolled out. So the doctors leave the country. We have an extremely high immigration rate, specifically of specialists also in South Africa. And it's excellently trained doctors that go and look for more, not greener pastures, but more stable pastures elsewhere.
Let's look quickly at the disparity between the numbers of doctors working in the private sector compared to the number of doctors working in public healthcare. Give us those figures, if you will.
So it's roughly a 30% in the public health sector versus 70% in the private health sector. But that doesn't give you a very clear picture. As I mentioned, there's many people in private sector that would want to be in the public sector. It's also the private sector that often support NGOs and volunteer work. So there's many doctors that do more than just work in the private sector. And I think we also need to move away from the narrative that private sector is everything that's bad and public sector is everything that's good. That is also indeed not the case. But the problem is that there's a minority of doctors providing care for the majority of the country. But I do believe that part of it is absolutely poor planning and poor utilization of funds and not thinking in terms of restructuring of services. The conversation is the whole time about the NHI, but if you look at healthcare reform needs to take place on two levels. The one part is the funding aspect that needs to be reformed, and that is the NHI. The second part is the service delivery aspect that needs reform. And we know nothing about what government is actually planning in terms of service provision and the restructuring of services within the NHI. That's where a lot of uncertainty are.
So even when you talk about the NHI, and that's supposed to reform the funding side of healthcare, NHI seems to almost be like a swear word. A lot of South Africans who are forced to access public healthcare, for them it would be a chance, hopefully, at accessing a level of basic care. But for anyone, as you say, within the healthcare profession, there's a lot of uncertainty associated with the NHI. Do we need to get to a point as South Africans, both in and out of healthcare, where we stop looking at the NHI as a potential threat and embrace it? And do you think it's going to solve a number of problems adequately?
I think there's a number of people that see it as a threat in terms of job stability, maybe, especially in the private sector. But I also think we should stop looking at the NHI as a solution to all our woes. It's not going to be. There's an increased onus on us as South Africans to take care of ourselves in our lifestyle diseases that can be prevented, and thereby preventing the onset of the disease, and especially the global burden in terms of non-communicable diseases such as obesity, diabetes, hypertension. Because if we can prevent those illnesses, we also decrease the pressure on the healthcare system. But I think it's important to know that looking at the NHI, it's not something that's going to happen next year, 2 years, 5 years even. Even if we look at international examples of countries where there are universal coverage, and we all are pro-universal coverage. We want equal access to healthcare for all. I think that is very, very important. However, even in the first world countries, where there is 73% of the country as taxpayers, the universal health coverage is not without problems. You sit then with waiting lists of 2 years to get simple procedures. When in South Africa, we do not have that waiting list, even in the public sector. And we have people coming from abroad to come to South Africa because of our good quality of care. Yes, in the private sector, but what can the public sector maybe adopt from the private sector, especially in service provision? So it's very important that we stop thinking that NHI will be the ultimate solution. It's an important solution, but not the only one.
So the government is often criticised for missing the mark when it comes to implementation. They formulate great plans. You're saying here is a bit of a black hole in terms of the planning, where service delivery and discrepancies with budget allocations are concerned. Do you feel there's sufficient consultation from government with experienced professionals, experts in the industry, to try and resolve those issues and find the answers to those missing questions?
I think there has been conversation. I do believe that healthcare professionals on the ground feel very, very much excluded. And the problem is also with the consultation, it's often selective in terms of you consult with people that support your view or people that support what you want to hear, and don't always listen to the words of warning and the words of advice in terms of potential difficulties. Remember, challenges is also opportunities. It's not necessarily have to be a threat. And I think that is so important, that although there are stakeholder consultation, perhaps it's very selective, that it should be broader. But then once again, there has been calls for input from the public and for many individuals. And then there's a sense of apathy. People do not actually respond to that call for responses. For example, comments on a white paper or a green paper or whatever the case might be. But it is perhaps important that government not only consult with health economists, not only consult with other medical professionals, but perhaps also consult privately or in the private sector with business people, but people that knows about strategy and knows about implementation and execution. And that's also where our call from the business school is specifically. We have individuals that went through our courses for the past couple of years and are highly qualified people with experience and the know-how to have a systems perspective, because it's very important that healthcare is not seen in isolation. And that's why NHI can't be the only answer. We need to take into consideration unemployment, the social determinants of health, education, even energy provision. It's so important that all those different people also talk to each other. For example, just where it's impacting us now in terms of energy provision, if you look at the big hospitals, they have to keep their generators going. They now spend their healthcare budget on acquiring diesel instead of having theatre time, and people are impacted negatively by that. So it's so important that we cannot consult only in one sector. It has to be a systemic perspective.
Thank you so much for your valuable insights. We really do appreciate that. That was Professor Renata Schoeman, Head of Healthcare Leadership at Stellenbosch Business School, talking to us as we commemorate World Health Day.